Mute. Hi everyone. We're going to be on mute. So if you want to chat, you can either put something in the chat room. I'll keep that open so I can view it. And if you want to talk, you can unmute yourself. I'll make sure that's done. But we're going to make it, I'm going to record it in speaker view so that Dr. Andrea will fill the whole screen. So where is my mute people? I thought it was under participants.
There's another.
Whoops, I don't want to. Dr. Andrea, I muted you accidentally.
All right, very good. I'll unmute.
I guess I just went through and. Okay, Brenda, go for it. We're recording, so.
Okay. Tonight we have Dr. McSwain. I'm just saying what was put in the email. Dr. McSwain was trained as an OBGYN, but left that field after being disillusioned with the requirements for certain procedures and surgeries. She is now a functional medicine doctor. Her philosophy is to find the root cause of a problem to help fix it rather than just treat the symptoms. Her office does infusions of vitamins and a brand new treatment called PRP, which uses your own blood to help heal. They do extensive testing to locate systemic shortages of key nutrients and help the body to repair itself rather than just treating the symptoms that show up. She's going to discuss with us this evening the reasons digestive enzymes are so important to your health. That's it.
That's very good. And then I just wanted to make sure I had the timeline right. So do you want me to speak for about 45 minutes and then have time for question and answer? So we finish up about 7. Okay. I'm fine with that. If you want to interject, I'm very good with that too. This can be a very fluid conversation. I would love to hear if you have a question, or maybe not even a formulated question, but something more of a concern or a comment. And, I can expand upon that or incorporate it into my talk. So basically, I want to talk about some different parts of digestion and the power of digestive enzymes. And then first, I'm going to talk about your role for your immune system in your digestive tract, kind of the embryologic formation of your digestive tract, the phases of digestion, absorption, and elimination, and the differences between the two. I'm going to highlight some organs in your digestive tract and their roles and some of the crippling effects that can have on the body when there are problems. And then I'll talk about some of the testing that's present for different digestive enzymes, so you just have a better awareness of that, and the potential that there is testing for these things. You don't have to wonder if things are happening. There actually is ways to know that objectively, and be able to evaluate that along with your symptoms. And then the other thing is just some discussion about supplementation ideas, whether it's as things like ACV, all the way to maybe more sophisticated or more maybe not even, that's not the right word. I think ACV is rather sophisticated, but some ideas about conventional, particularly when it comes to the pancreas. Okay, so the immune system in the gut is really interesting, and I think this is like, if you understand this, it's like, okay, wow, how does it even exist? How do we even exist as human beings? So basically, we take foreign bodies all day long and we put them into the central cavity of our body. Well, you can only imagine that the immune system is going to be on full alert every time something enters your mouth, right? So there's no question that most of your immune system would be right there, because your body is having to defend itself all the time from everything you put in. So you could say like, well, I drink good quality water and I eat really good foods. Well, yeah, but still there's bacteria and viruses, and your body doesn't necessarily know that something coming in is a beautiful, perfect, organic blackberry that's only been sun ripened, etc. It could be something that's very toxic. So your body doesn't necessarily know the quality that something's coming in the mouth. It just considers a foreign body. And so it activates the immune system. That being said, when your body's immune system is activated in your gut, nothing else matters, right? So if you have inflammation in your gut, your immune system is on full alert. Digestion and absorption, elimination, those are not necessarily concerns for the body. It's going first into protection mode. And I just want you to think about that, because sometimes people have struggles with absorbing their foods, or they feel like they don't get anything out of their quality foods, or they're not absorbing something at the level that they think that they should. And I just want you to know that if you're dealing with a level of inflammation that's high, then digestion, absorption, elimination, all the other things that go on in that tube are not going to be given much value, because your body's protecting itself. So just something to think about. So, and in the gut, you can have a lot of things, viruses, bacteria, and all those things can play into how your body produces digestive enzymes. So, or if your body is struggling to produce digestive enzymes. So that's a little idea about the immune system that really just kind of floored me. I mean, I'm so passionate about learning about the body. And when I think about things like that, those are some of the stunners that I've had in my career. And I think that was a stunner. Like, oh my gosh, every day I'm putting something completely foreign into my body. So of course my immune system is going to be gathered inside to protect me, right? So anyway, so then if you think about the tube, right? So in the beginning, we were all tubes. And, you know, when you start as 2 and then you kind of morph into 3 to 6 to whatever. I mean, the duplication pattern there is really quite amazing. At some point, you become this tube. And then the tube diversifies. But really, if you think of the digestive tract as a tube, you start here at the lips and end at the rectum, then what's going on in that tube? And that tube of processing. So all the while, your body is working to break down everything that it receives here, and then process it, break it down even further to a level that it can then be absorbed and appreciated as nourishment for the body, and then circulated through the system. And then at one point it becomes waste. And then the body has to work to protect the rest of your body, to contain that waste and then remove it appropriately. Okay, so that's a lot of work for one tube, but it all works out. And there are some actual discrepancies that happen in timing in the tube, and I'll talk a little bit about that in terms of digestive enzymes. So when we look at the beginning of the tube, that's the first part of our conversation about digestive enzymes. And a critical part of that is the salivary glands and also dental health. So, you know, the body is, and the tonsils, which the tonsils and the adenoids. And people say, well, I don't have those. And I say, well, you probably do actually, because no surgeon is really that good to remove your tonsils and adenoids completely. And there's a level of regrowth even in most people who have had a removal of their tonsils and adenoids. So if you think they're gone, they're probably there. And they might, I've even felt them. I've been like, look, you have 80% of the tonsil that you would have in your adult size, even if you had them removed when you were 5 years old, like they're still there. As part of my manipulation, I actually palpate the tonsils, and they really harbor a lot of junk. So that speaks to the gut tube always working this dynamic of doing its job, when part of its job is protection. So in the mouth, which is loaded with bacteria, it's just a really amazing place, but it can hold a lot of health and success for digestion if you value the salivary glands and you value the breakdown of food in the mouth. So this is particularly important for people if they're eating something that's raw or that's not necessarily broken down more completely by a cooking. You know, if you're under 140, you're gonna have something that's going to require a lot of work to break something down. So chewing 30 chews can really almost emulsify any food or any item in your mouth. But 30 chews is a really important base. So if people say to me, like, I don't digest my food, or I hear everything, I say, well, do you chew every single mouthful 30 times? And if they say no, I say, get started there. So, a lot of times people think it's about adding water while they eat, but it's really, you want to be hydrated, but you really want to get that chewing in to break down the food. So then when it goes down to the esophagus, you don't have that resistance because it's broken down a lot. And you need it to be broken down. So now the tube, the esophagus, which is, just a powerful muscular tube that, is bringing food. And at some point it has to go past the diaphragm. Now, most people have restrictions in their diaphragm. And so people who have feelings of indigestion, there can be a mechanical problem there. So if people feel an indigestion or they feel food or regurgitation, there's definitely a mechanical aspect to that, which is their torso might be compressed. Their diaphragm might not allow for the adequate space for their esophagus to pass food through the diaphragm. So the esophagus is a tube that goes through a hole in the diaphragm. The diaphragm is a very interesting layer because it's triple crosshatched. And so it holds the aorta, the esophagus, and the vena cava. And so it has to have a lot of stabilization there. But sometimes that can lead to constriction. So if people are noticing a regurg, again, oftentimes there's a mechanical reason there. So the food now, which is fairly liquefied, it goes into the stomach, and at that point, it's got to be annihilated of a lot of bacteria, viruses. So the pH drops significantly, and the stomach is a highly acidic state. And so that's where the body adds a lot of acid, and it needs to do that, right? Because again, if we talk about what I mentioned in the beginning about the immune system, if you don't have the acidity in the stomach to kill the bacteria and viruses that are now entering the inside, the inner workings of your body, it's going to be fraught with problems. And so sometimes it's very popular for people to take a beta blocker, an H2 blocker, or propranolol or pantoprazole, or not propranolol, sorry, pantoprazole, or what's the brand name for it? So anyway, they're taking an H2 blocker, or they're taking an antacid, right? And what is that producing? It's increasing the pH of the stomach. And so an antacid is actually an immune suppressant. When you really put it, I know it's a bold thing to say, right? But if your body has created a bucket of acid, why did it do that? Why is there a bucket of acid that you have to have a very thick lining around the stomach, and it has to be there? Because the body wouldn't put it there if it didn't need to be there, because it's very dangerous, right? So now you have this very acidic bowl, this bucket, and then the solution is to actually reduce the pH of that bucket. No, that's kind of off the table. You don't really, that's not the way to go. That's not an approach that's long-term. Obviously, if someone's facing indigestion, extremely rarely, they probably could tolerate it actually. But anyway, so now you've got the stomach, it's got the food, it's highly acidic, and now it leaves the stomach, right? And there's all these sphincters that say, don't come back. We don't want this stuff to come back. We want to have it going down the tube. And then it'll enter the small intestine. And at that point, its jobs be broken down even more. You get a lot of enzymes there. So we think about the support of the liver, the gallbladder, the pancreas. We'll talk a little bit more about those later. And then you go down and you're in the small intestine now, and the food's being broken down. But then where do you go at the end of the small intestine? You pass by the appendix. So again, another immune organ, which I think is very significant, because at this point, the body's saying okay, I've absorbed the nutrients. This is a one-way road. Don't go the other way. I don't want all the gas, or I call it the party of the colon, to go into the library of the small intestine. And I consider the appendix as a bouncer. So the appendix and the ileocecal valve there are making sure that as the food leaves, that the bacteria that are in the colon, that party that's going on, that we want to have a little bit of a party going on in the colon, but I consider the small intestine a library, and you don't want that party to go into the library, right? You want a very calm small intestine. It has very few bacteria. You don't want any of that. But what is helping you is your immune system. So if your immune system is now having to struggle because someone is taking an antacid and they have a lot more susceptibility to having a lot more bacteria in there, or they have a gut infection or a parasite, that could be bacterial, it could be parasitic, which is amazing how many parasitic infections I see in people quite often. It doesn't have necessarily relate to international travel. It is very, very obvious that parasites live in the United States too. So they didn't know that they weren't allowed here. They never were notified that they were not allowed to live in the United States. So anyway, so then now you get into the colon, you're starting to get at the end of the tube, but then you've got gas, you've got a lot of bacteria that people can bloat from. At this point, your body's just really trying to extract water, and it's also trying to remove it as waste and then out the rectum. So it does it in a squirrely way, right? Like just to think about this, because how is this then impacting your organs, right? So your colon is huge. It's just huge. And it has to go up, over, down, and then it wiggles at the end. I mean, really? Why would it do that? I don't know. Why isn't it just a tube? It'd be so much easier. It's just a tube. But it does all this shenanigans. And when you get those shenanigans, you just have to be careful, because those the going up part on the left side, then there's a little kind of a sling or a swag. I always think of a curtain swag. And there's one for the hepatic flexure, which is the liver. And then there's one for the splenic flexure, which is the spleen. So this little part can be really saggy, and it can make you feel really horrible if your body just traps stool and bacteria and gas in there. And then it also kind of compounds with, as I mentioned originally, if these flexures are narrower, that means usually the diaphragm is also narrower. So there's compression on the esophagus. So then going back to the colon, then it comes down the right side, the left side rather, and it goes out. Okay. And so if you have any pelvic inflammation or swelling, then you have these disruptors. So my point with that is just, you can put a lot of pressure on the organs. You can put something in there that the colon, if it's not emptying completely, it puts a lot of tension in the system overall. So anyway, I think that's an interesting conversation about the tube. So, and I'm not even gotten started really. So anyway, then I want to go to this other idea where it used to be you are what you eat, which I probably never really believed that, right? But anyway, and then now it's really you are what you absorb. So we look at these characteristics about digestion, absorption, and elimination, and you are not what you eat, right? Because as we know, people can eat a whole bunch of things, and it is not food. People tell me like, well, I eat that. I'm like, well, you could put that lampshade in your mouth, but you can't call it food, So it's like, I kind of like, I don't know if you ever deal with me in my office, I'm trying to drive a point home quite a bit. And I think we often get told that things are okay by convention because someone's trying to sell you something because now you have a problem. Whereas like, I want you to have a solution so then you don't have a problem anymore. So, it's a little different dynamic. So I try to be a little more real, which is like, just because you put it in your mouth doesn't make it food. And that's like, you are not just what you put in your mouth. You're not just what you digest. But it's what you absorb. And you are what you absorb. And tragically, being of, a biomechanical component that we are, a machine that only with a mortality, as we age, our absorption can decreases. So you have a metabolic age and a chronologic age. And this is important here because metabolically, you might be quite young and vibrant, but chronologically, you might be older than that. And vice versa, unfortunately. So we see a lot of people now, teens, 20s, 30s, who are chronologically younger, but metabolically older. And I very much believe that. But we have to look at metabolically, what is your age? Because then you look at absorption rates, like I think it's 60 years old metabolically, your absorption rate is less than 50%. You're absorbing less than 50% of the nutrients that you're receiving in your gut. So then you think, well, I'll just eat more blackberries, right? And it's like, well, it's not quite it. You have to look at, you just have to recognize that your absorption levels are, that we decline metabolically. And as we age, our absorption percentages decline. So then you might consider looking at other means for supplementation, transdermal, sublingual, those ideas for breakdown. I could talk about that too. I'll just write a little note, see if I have time to talk a smidge about that idea. But anyway, sublingual. So then, also when people talk about how their food is delivered, right? So sometimes food that's broken down in a blender is going to be a lot easier to process. It's been liquefied before you receive it. Then that is another way to improve digestion or absorption, because now you've assisted with the breakdown. So about absorption, this is a really important point about autoimmune disorders, and that is when people deal with a reduction in the breakdown of food, right? So how do I explain this? So, well, I know how to explain it. So basically, your body is bringing the food and it's breaking it down. So at some point, it's a difference of your body sees that there is a book, but it's used to seeing a page. And so now your body says, well, I don't know what a book is. I only know what a page is. Although you would think they're very quite similar, right? So in a food idea, it's your body's just looking at something that's not as broken down as it's recognized, right? It's like also, if you think of a little baby when it sees a daddy with a beard and without a beard, it's the same person, right? It's just sometimes the babies will cry when the beard goes away because they don't recognize that person. And so it's the same idea. It's the same person, but imagine your immune system crying because like, oh no, that's not what I'm used to. That's not what I process. So the body says, well, that's an enemy. Just like that little baby that's crying. Well, that's an enemy. But it's not an enemy to you, the eater, right? You didn't think that you were putting something in your body that then the body was going to recognize as an enemy. Unfortunately, this can happen. And it can happen when there are disruptions in the breakdown of the food. So it's not a sufficient amount of a breakdown. And now the body doesn't recognize it. And so as a natural part of what's supposed to be there, it doesn't recognize it. So now it determines it's an enemy. And now it circulates that enemy recognition in the blood supply, in the immune system, throughout the rest of the body. Well, here is some of the tragedy, is that food is very similar to other parts of our bodies. So people will talk about like gluten is very similar in structure to parts of the thyroid cells. So now the body will see gluten, which is a natural component of many foods. It's been jacked up, multiple times over and put into processed foods, but it isn't a natural. It's in a lot of foods. It's in a lot of things that come from nature. It's just we get exposed to it because it fills us and bloats us. So that's why the food industry uses it as an additive. But it is good. It's just if the body sees it and doesn't recognize it, it sees it as an enemy. And that's how some people can develop thyroiditis or inflammation of the thyroid from gluten exposure or persistent and elevated gluten exposure, which is not celiac disease. It's a food sensitivity. But really, what does a food sensitivity mean? It's that your body's starting to recognize something that's too much. It's starting to see it as an enemy. So through improper breakdown of food, the body can then start recognizing these pieces as foreign. So that's an issue with absorption and breakdown and digestion. So that's a really important idea when you're thinking about people who seem to be developing joint pain or thyroid problems or all these kind of autoimmune symptoms. There can be a relationship to an overwhelmed immune system in the gut. We can test for that, which is cool. Very cool. So speaking of those things, I think I would kind of wrap up that section by talking a smidgy about elimination, but because you can sometimes, yeah, I think it's fair. You can sometimes think about, well, what is the support that that elimination needs, right? And elimination needs sometimes what people call vitamin F, which is fiber. And so you need fiber to help move all this out. So if your body doesn't have enough of that, where that can, so sometimes you can view fiber as a, where you really want about 25 to 30 grams of fiber in a day to help you moving everything through the system. So it's not technically a digestive enzyme, but it's definitely paramount to the process of digestion and the gut tube working through. So I would say it's significant for this conversation, for thoroughness. So next I want to talk a little about the roles of the organs. So I'll tell you my favorite organ to work on is the liver. It's the easiest organ. I love getting people better with their liver health, cleaning out the liver. The liver processes a lot of stuff. It becomes like this really icky filter. And so people sometimes can't process their fats. The same with the gallbladder. I kind of view them together. The gallbladder and the liver are a lot about the fats and the breakdown of the fats. And so if people are struggling with that, and they can be having a liver issue. And the liver is very easy to clean out. It does really well getting nourished. It has a very good amount of turnover. It's just a very beautiful, kind of steadfast workhorse organ. And then the gallbladder too, it just pumps out, fat breakdown, wants to break down that fat because fat's a macronutrient. So it loves to break down fat because it's so important for healing. It's so important for hormones. It bathes the cells, with fat is just a very calming, important things for neurotransmitters. I mean, when you have a macronutrient, your body wants to break it down. So your body loves to break down fat, but the liver can get overwhelmed. The gallbladder can get overwhelmed. Some people, when in doubt, cut it out. They've unfortunately been on the other side of that. So they have their gallbladder removed. And that is fine, but that just means the liver has to work harder to process fats. I would prefer someone not have their gallbladder out. There's a lot of work we can do unless the gallbladder's ready to rupture, which it's not like that. The gallbladder and the liver they don't really do that. But if, sometimes you can have a big enough stone where the gallbladder will get a little stuck and it won't move. It's cholelithiasis. So it's just some of those crystals just start to gook up. And sometimes that's just because of a pump issue. You can imagine you have all that fat breakdown substance in the gallbladder, and instead of this churning fantasticness, all of a sudden the liver, which wants to pump, is having a reduction in pump because it's a little full with toxins. And now you don't get that really lovely pump going on. And then the gallbladder kind of gets stuck a little bit. It gets kind of fixed, and then you have some stone formation. So anyway, that is what the liver and the gallbladder do. They like to break down fat. And then you get to break down proteins in that area in the small intestine. And then the pancreas, which is a lot about processing carbohydrates. Insulin is a really important digestive enzyme. It can activate, it definitely regulates your blood sugar throughout your body. And the pancreas is an organ that nobody works on. So, never touch the pancreas is what I learned in med school. Even before, I didn't even become a general surgeon, and they said never touch the pancreas. The pancreas is very finicky. It is an incredible organ. I don't understand it. I can help people with that, reduce the progression of disease in the pancreas, but I cannot reverse disease going on in the pancreas. So in terms of reversing organ dysfunction, the liver is incredibly easy. The gallbladder, the small intestine, the esophagus, the stomach, all these areas, but the pancreas does not go backwards. It just can stay where it's at. So that's really important. You want to know your insulin levels. You want to know your blood sugar. You want to know your cortisol, because the pancreas is the organ of longevity. And it is an organ that is paramount to people living for a long, healthy life. And you will know that because people who have pancreatic cancer don't come back. They leave. Because the pancreas, you can do nothing with the pancreas. It is the end. And it's not the end because it's cancer. It's the N because it's the pancreas. So when you're looking at processing simple sugars and you're looking at if the pancreas is being tapped out because of high insulin resistance, high cortisol, stress hormones, you have to stop that because it does so much less about digestive enzymes as it is to longevity. And again, I joke a lot in my practice because a lot of doctors don't think about the organs and their aging process and their ability to reverse the aging process. But I'm like, give me any other organ and we'll make it work. Even kidneys, which is pretty important. Like kidney reversal, kidney filtration and reversal is, a lot of people don't even touch it, but we do here, and it's great. Just no, the pancreas, I gotta stop it where it's to get people better. So that is how powerful it is. And that is why I have to say, like, I'm gonna cut to the chase. And the most important thing I'm gonna say to you today is there are many ways to support the pancreas. And one of the most important ways is papaya enzymes. Papaya enzymes, papaya seeds are basically papain. These are all many words for saying pancreatic enzymes. So papaya seeds, papain, you'll see it as papain. That is, you want to be eating papaya. You want to be eating papaya seeds. You can buy papaya seed powder. You can have a teaspoon a day with a little bit of honey or a little bit, usually it's honey. It's a very good anti-parasitic agent. So it's pretty impressive. But anyway, the pancreas as an organ to secrete digestive enzymes is really, I just want to tell you about the pancreas today. That's really why I wanted to tell you, because I think it is so important for people to understand when they're looking at health and taking care of themselves, or really matters. And I have so many people that come into my practice and they're doing so much for themselves. And lifestyle medicine is very critical. Lifestyle medicine is the work we do every day. It's how we act, what we believe, how we move, what we put in our bodies, how we sleep. It is so important. And I just want you to know that part of that is making sure that you get the digestive enzymes that support the pancreas. So anyway, love the pancreas. And I was listening to oncology doctor speak probably a few years ago, and they said the pancreas actually forms at 9 weeks in utero. And I have not looked this up, which I usually do. So I always clarify, I have not researched something in its entirety because I think this is a very difficult thing to find. And I haven't found it, that's why. But I believe this person because the fetus is a very important thing to study. So having studied a lot about the fetus to be as an OB-GYN in training, I know a lot about how we form. And for the pancreas as an organ that's primarily considered a digestive organ to be forming in the first trimester is really much more telling about something deeper that's happening that we may not understand about life force that's occurring at the core of our body. So because we don't use our gut does not unaccordion until 3 days outside of the womb. So we don't even use our gut until after we're born for a few days. It doesn't open. It just moves stuff through, but it doesn't actually open and have an inner working. It just serves as a tube until even the first 2 to 3 days after people are born. But why is the pancreas coming in weeks after, conception? So anyway, really important food for thought. Haha, little joke. So then I just want to go into, some ideas for testing. Not that I think you need testing. I just want you to know what it is and what you might hear. And if you are struggling or someone you love is struggling, you want to have a sense of what you can do about it. So the first I'm going to talk about is actually the SIBO test, which is actually methane and hydrogen. And I don't love this test. I actually personally have never ordered it because it just doesn't make sense. I think SIBO which means small intestinal bowel overgrowth, and you'll hear it. It's a really important topic where basically the bacteria, remember the party of the colon, they get into the small intestine, and then they produce methane and hydrogen where they're not supposed to. You know what? I don't have to have a test to listen to my patients. It's clear if they have SIBO. They hurt because they have this bacteria having a party in the library. So if I ask them questions and they tell me or describe that the party is happening in the library, they have SIBO. That's it. Like small intestinal bowel or bacterial overgrowth. So in the small intestine, bacteria have overgrown. They're not supposed to be there. Got it. Let's fix it. A lot of times that's just helping with the elimination aspect. And then that will improve absorption. And that means the small intestine will get better and the whole tube will be a happier place. So I'm not big on the methane hydrogen SIBO test because it also is a very hard to interpret test. It's kind of does this and not everybody has the same transit time. So then you have to try to put in too many variables into the system because everybody knows that they don't poop the same time that everybody else. Some people poop, they have a cup of coffee and they poop. Other people, they'll be 2 days. Other people, you know, it's like, so you have to really look at a variable of transit time in this test. So I don't get it. It doesn't mean anything to me because it's too many variables. But anyway, methane and hydrogen, those are byproducts of bacteria, and they can often tell you what your level of absorption is. And sometimes people can improve that by improving their acid, right? So they're killing some of the bacteria that preemptively. So there's, and then they can reduce the amount of overproduction of bacteria or overgrowth of bacteria. So acid is a really important part of your gut health if you have the right amount of acid. And then another, 2 other tests are really important. Well, I don't mean it like that. Let me rephrase that. So there's ways to test your fat processing, and that's steatocrit. Steato is fat. And then elastase, which is protein. So you can actually tell if your body, through a stool test, is processing your fats and your proteins. So that's good information if you don't feel good. The other thing you can tell is how your immune system is responding inside your gut. That's through the IgA test. So is it over responding because it's inflamed? Is it responding within a normal range? Or is it responding in a state of deficiency from exhaustion? So those are some important ideas to think about, because is your immune system working too hard in your gut so then it can't focus on other areas in your body? And then another test is the anti-gliadin, and that tests gluten, because a lot of times people think, well, I just can't have gluten. And then I test them and I'm like, well, I don't think you should go for broke, and having a ton of gluten, but your problem is not gluten. Your body does not view gluten as a sensitivity. And I think that's important. So that all those things you can tell in a stool test. But anyway, I just wanted you to know about some basic ideas for testing. And then I wanted to get back to this idea about, it actually transcends into my next idea, which is supplementation. So,
Dr. Andrea?
Yes.
Could you go back to the test if your stool is processing fats and proteins? Can you
Spell that out?
Yeah.
Steatocrit is fat, Steatocrit.
Okay.
And then protein is for elastase, ELASTASE.
Okay, thank you.
And all the tests I mentioned, most of them are actually done as a stool test.
Okay.
So an easy poop test will tell you a lot of other things like your bacteria. And I'm not going to necessarily go into those testings. I just wanted to, there's many, many, many more tests about the stool, but I'm not going to elaborate on those. I just wanted you to know that from a digestive enzyme perspective, there are a few ideas there just to give you an understanding that there is objective data to help you understand what's going on in your body. So the next idea is, as I mentioned about acid, well, how much acid do you have? And I want to give you this little test that it helps people understand, because I think indigestion obviously is a very important conversation, right? A lot of people have indigestion. You know, I love the commercial where the lady is like totally stressed out. It's clearly like 3 p.m. She's worked all day. She's doing double time on the phones. She's in the office. She's got the 4-inch stiletto heels. She's probably got the pantyhose on. Her clothes are probably too tight. And she goes out to get a milkshake and a chili cheese dog, as if that is the thing to eat, right? At all this, right? Like that's going to make your life better, right? So I just love the way they set up this commercial as if that is like a norm, right? So like I'm totally stressed out. I got stilettos on. It's 3 o'clock in the afternoon. I'm in this huge skyscraper and I need to eat. So I'm going to grab these 2 items because that's how I make choices in life. And so she grabs this, and all of a sudden they show this diagram, right? She's so inflamed, and I'm laughing. It's like, she should be, something inside her should be very angry that she is doing all these things to herself. So not only is she not getting her 30 chews in, she's also not forest bathing because she's in a skyscraper. So even if she turned on her computer and looked at a forest, it's a Japanese principle, but if people look at that and they eat, they will allow the parasympathetics to come into the body. And the parasympathetics are the calming part of our nervous system that improves digestion and absorption. So when you are in sympathetic overdrive and you're in fight or flight, your body is going to move blood away from your digestive tract and put it in your muscles. When you are forest bathing, chewing your food, enjoying the company. Some people say don't eat around other people. I just think that's, culturally it's joyful to eat around other people, but you're having a good time, or you're looking at a forest, even if you're on your computer, and you're allowing your parasympathetics to then bring blood supply to your gut. That's very important for you to digest. So that is another form. It's a non-pharmacologic supplementation, right? Which is the time and the energy to chew, to enjoy, to forest bathe. And in these ways, now you've increased your digestive enzymes because you've brought those ingredients to the table. So anyway, when we do that idea, the body can go with the timing that it's organized to do. So I like to explain indigestion in that people eat quickly. So a lot of people who have indigestion eat very fast, and they eat like this, right? So all of a sudden that food is just like pushed down into the stomach, right? So, and then what happens is it really doesn't have the time to churn in the stomach, right? So that acid doesn't really have the time to churn. And the messages from the body can't really be processed that quickly. So there's not as much acid either happening in the stomach. And so the stomach produces this churned up stuff, but it's not what it should be. So then the small intestine tells the stomach, what is this? Imagine being on the factory line and the small intestine is like, really? You gave me this? So then the stomach's like, oh, at that time it's getting the acid produced as a response to your eating, but it's too late. The food has already moved a little bit past the system. So now you have food over here in the small intestine, and you have an acid secretion overload in the stomach. Well, where's that acid going to go? Because it's irritating. It wants to be around food. It can happen and create indigestion up the esophagus. So it's a timing issue. And then over time, people say, well, I have to take an acid suppressant because I get this indigestion. And it's like, well, your timing is off. So you can supplement acidity into your diet. Some people use betaine, which is basically HCl. It's betaine HCl. Apple cider vinegar, I think, is a better place to be in an physician supervised situation. Apple cider vinegar is all things to all people, as far as I'm concerned. You just take a shot of it and make sure you keep it away from your teeth because it can erode the enamel. But you sip on it for 20 minutes. You do that and you make sure you rinse it so your teeth stay clean, so your enamel stays preserved. But other than that, it is really paramount for things that we don't understand that happen in the body. So ACV is fantastic. An ACV shot in the morning, warm lemon water in the morning will help with the processing in the body. But apple cider vinegar, sometimes people need it before they eat. A cap, it's nothing. It's a capful, throw it down, chase it back with some water. have your meal. Other people need it after they've eaten. So I say just try it for a week one way. If it works, then keep that way. And if it doesn't work, try it after the meal, right? I mean, just experiment. It's your body. Nobody knows how your body exactly going to work. So that's how I think it's really helpful. And then let's see. So of course I discussed the value of papain and really important for pancreatic support. There's ways for fat breakdown. These are simple like we have Digest Forte in the office. You can get into a little more complicated, ox bile. Some people use animal products. So that's an important consideration. If that does not fit your value system, there's other options. There's definitely things. There's some that are more fat dominant or more protein dominant. There's some that break down carbs. Chromium is really good for distributing carbs. So in some ways it's not an enzyme, it's a cofactor, but it really supports carbohydrate distribution. So it can be used by your muscles. So even though it's not a digestive enzyme, it's often in the body as a digestive, it's often considered in the GI categories because it's so good for how to distribute the sugar. So I just want to make kind of a caveat here and talk a little about B12, because oftentimes B12 it's actually, there's a lot of talk about it being produced by a healthy bacteria in your gut. So a lot of times B12 is deficient for people because they don't have the bacteria that makes it. And it can just if someone's struggling with digestion and absorption, they want to make sure they know their B12 levels. They want to be somewhere around 1500 because like most tests would put it about 1500 is a good value. So it depends on the test, obviously, but because B12 is very important for energy, and it just kind of is a marker for how well is your gut doing kind of on its own. So that's one of the things I look for B12 to help me evaluate. And then just another caveat, just another little, I don't know, kind of buyer beware idea, which is I have seen people who do have pancreatic problems and they have been put on pancreatic enzymes by a physician, a good meaning physician who writes it to the pharmacist. But unfortunately, the conventional pharmacology companies, they make the prices of these enzymes. I've seen patients pay $400 a month for these enzymes. And because people are told that they need this to live, and they're right. I mean, I totally agree with that. But I remember the first lady I met who paid like $400 a month on these. My daughter did my nails. So if it looks like a child did my nails, it's true. Just anybody's close enough to actually see that. So I remember thinking, am I confused? And, so I always question, what's that, where am I, so I'm always revisiting these ideas. And so I look at her script, I look at her bottle, and I go to the health food store, right? At this time, I didn't have a clinic, I didn't have an office. I go to the health food store and I'm like, oh, these are the same ratios, but this bottle is $35 or $40 a month. And she's paying $400 for a pharmacologic agent. And it is the same thing. So, I was just flabbergasted by some of these ideas that we're told. First of all, get stressed out and eat your milkshake and chili cheese dog and expect to have, feel good. And the other thing is buy an extremely expensive, prescription when you definitely want to be having papaya seed powder at that point, right? And then you want to make sure your supplement with a good amount of dosage so your pancreas is supported. But anyway, so that is what I want to say for supplementation ideas. But it is it's something to look at needing digestive enzymes. And I think definitely people who are looking at having a healthy 70s, 80s, and 90s need to be really aware of the fact that that's something that's really going to help them. Because there's a wearing out process to some extent in the body. And while I believe people should be healthy at 100, I think you got to kind of make sure that, that's not, it's going to happen by hanging out, right? You got to put some effort into that healthy at 100 idea. So one of those is digestive enzymes. And you can get them food-based, you know how to break down your food, all these things, you're paying attention not to just what you're eating, but how it's being processed in your body. And I think that's also one of the major messages for today is not just that you're eating good, but that it's actually symbiotic to what your body is able to process. So that idea, it's that not just that you're eating good, that you really are getting the most out of the food, and that your body isn't just sitting in a state of inflammation and you're wondering why you're not absorbing everything. So that's important. And then, yeah, I think that's kind of my spiel. I think I went way over time, so I apologize in that respect. I don't know how the 15 minutes slides by, but yeah.
That's cool. That was so interesting. Thank you so much. So if you have a question, you can type it into the chat, or you can unmute yourself and ask. And we can go however long you're available. So who has questions for Dr. Andrea? Those of you that are on a phone, I don't know how you unmute.
I think there's a key button. I think there's a button option.
If they dialed in?
Yeah, I think so.
Okay.
Is it Jeannie?
Yes.
Anyone can just.
Okay.
Yeah.
I want you to talk about flatulence, if you can.
Sure.
Well, there's different kinds, and I'm just noticing this. There's someone that in my family, the flatulence sound changed to be more liquidy. Is that a concern? What is going on there?
Yeah.
And then, when you hear the sound, it's like it's like a gurgling kind of a sound. You know what I mean?
Yeah, it depends on if it's gurgling. It's not just gurgling, it's gurgling and then flatulence. So there could be some accumulation of stool. That's the interesting thing about the colon, is it's never gonna break, never gonna pop open, and it's always gonna do its best to have a space in the middle for some stool to pass, right? So, but unfortunately, stool can accumulate against the wall. So it's almost like make sure you have like a center in the hole of the donut almost. So it can be a smaller space, but then you might have fluid be able to go through, but the colon itself is actually not emptying very well. So it's holding stool.
Oh, okay.
Yeah. So clearly flatulence is about gas production. But then liquid would tell me that there's a lot of stool accumulation and that the body is not getting that motility that it needs.
Okay.
So there's lots of good to be done, but mostly I would say discussion of enema, right? I mean, simple enemas, ozone enemas. I think coffee enemas are good. They just take forever. And then the other thing is, lavender is really good to help bowels move. You don't want lavender all the time on because it's a hormone modulator and it's pro-estrogen, but you definitely want to use it for that. And then fiber, increasing fiber. And then just actually massaging the tube. So I didn't mention this, but you can massage the colon one of two ways: in the direction of poop out, or from where poop's supposed to come out in the direction opposite of that. And you just pump, you kind of lovingly. I prefer to start where the poop hole is, like right at the base of the left, like the lower quadrant, like right at that, right where the genitals basically are, just a little bit above that to the left, and kind of, with the idea that I'm going to help smooth that out, right? And then like back.
Okay.
Open up the back, right? And open up the back door so that you start moving stuff out, as opposed to getting it at the ascending colon where the small intestine becomes the large colon on the bottom on the right side, and trying to push stool that's already in kind of a not blocked tube, not anyway obstructed, but definitely congested tube. So that's another way to improve gut health. But
Go ahead, Dorothy.
Sorry.
Thank you. That's very helpful.
I hope I'm not duplicating something that you've already said, but I was wondering generally among the digestive enzymes that you mentioned, if there are some that are just worthy of considering in your 70s and 80s anyway, just because of that slower functioning and things being a little bit probably less productive than they have been in earlier years.
Always papaya seed powder or papaya seeds. I mean, you can literally drink them. You know, you can have papaya. That's very helpful. And then also looking at your oil of oreganos in capsule form, your rosemary, adding all your spices and herbs to your foods. So those are really important. And then there's many companies that make digestive enzymes just as a combination one. So, you know, that will help you break up. And whether or not you are vegetarian or vegan, you want to consider that, because some of them are animal products. So for my patients that are vegan or vegetarian, I really try to help them see they don't want ox bile, right? They don't want glandular tissue. They don't want to eat that. So, and they shouldn't, it's their decision. So, you know, you definitely want to read all the ingredients if you're looking at a digestive enzyme. So, and then of course your fiber. So making sure that your bowels are moving. Yeah. So.
All right.
So
Thank
if
you very
you
much.
are eating a papaya and there's seeds in there, can you throw those in the blender, and or does there have to be some special way to process them?
You can eat them.
Okay.
I mean, if I have a papaya, I will just put them in, I'll put a tablespoon of water and drink the seeds.
Oh,
No.
just drink them whole.
Yeah, me just drink them whole. You can chew them, you can dry them, you can do whatever you want, but I'm really lazy when it comes to a lot of those things. So like, I just want it in and I want to move on. So, you know, also bulk supplements, if you can get it, they've been out of order for a while, is they make a papaya seed powder. They have a papaya seed powder. And I think that just the world of it. We actually, I know they've been out now for a few months. So
Who is that?
bulksupplements.com.
Bulk supplements. Okay.
Bulk.
Well, spell that, please.
Bulk, BULK,
Okay.
supplements.com.
Yeah, and you can find, if you're looking at that, but then oil of oregano is incredible. It's actually incredible, not only antimicrobial, anti-parasite, it's also for longevity because it's a chemo agent. It's actually a therapeutic cancer agent. It's incredible. We won't talk about that. Rosemary is the same thing. You can actually take rosemary extracts and it's cytotoxic to certain cancer cells. So you can just imagine how important that, if you take that idea about metabolism promotion and you think about oregano and rosemary and the ability to kill abnormal cells, which is always happening in our body, right? We have to get rid of bad old aging cells to bring in new cells. There's cell turnover. And then there's cells that have abnormal growth. There's always some level, or significant level of dysplasia or abnormal cell growth. And so the body is working to get rid of abnormal cell growth. And so things like oil of oreganos, rosemaries, and that's why you'll find them in a lot of digestive enzyme products. But a blend, most people I think are better off getting a blend because it's just overall well-being. But you want to make sure, papaya's in there. I mean, bromelain is really good. It's pineapple. It comes from pineapple. It helps with bruising. So there's definitely some role in the cascade for clotting. So, but it's just very good for your digestive tract. Great for breaking down things. So.
May I ask Dr. McSwain a question? This is Harriwanta Cromer.
Yeah.
I would like to know, Dr. McSwain, how would you suggest that the oil of oregano be used? That is really some powerful hot stuff.
It is hot. I would capsule it, Mrs. Cromer. I would capsule it and take it with a bigger meal. If you're concerned about it being hot, I would encapsulate it. That's how I sell it, is encapsulated. If I have someone who's using it for health promotion, I would say 1 capsule. That's hard for me to tell you. I can't tell you exactly how much is in it. Sorry. Of oregano a day with a fuller meal. If I was telling someone who's having a digestive problem, I would say have 1 capsule with each meal. And if I was using it as an anti-parasitic or antimicrobial agent, I would use it 2 capsules 3 times a day with meals. So having it, even if you're having it once a week, you can find the amount that works for you just to support health in your digestive tract.
Thank you.
I would think, just in my general opinion, I would think 3 drops in the capsule, and then the rest with some kind of mixing oil, coconut oil or V6 or something like that. 3 drops should be plenty.
Yeah, I'm sorry, I don't know the exact conversion.
Yeah.
Yeah, essential oils, but it's
At least with Young Living's oregano, because it's pretty pure. So
yeah. So start with 1 drop or 2 drops if you're concerned about it, and see how you do for a week.
yeah.
And again, try it once a day with your heaviest meal. And yeah, because it can really, and also remember, if it's attacking something, if the body's using it for antimicrobial, you might not feel as good as you think because your body's actually fighting something. So don't necessarily take the symptoms if they're negative, meaning if they're fatiguing or if you're having indigestion feelings, you might actually be killing something that is as an overgrowth or is not supposed to be there at all, a significant pathogen. And that's when you want to get a stool test, and you might be finding a problem, which is a good thing, because then you're gonna have a better life when your digestive tract gets taken care of. So yeah.
Cool.
So I see that with my patients. They say, "Oh, that made me feel really sick," and I'm like, I don't mean to be a smart aleck, but it's like, congratulations, like we found something and you're getting better, because sometimes you get a little bit of worse when there's something that's been bad that's been able to biofilm, and now your immune system is bolstered to be able to attack something. So you might, if you're feeling bad, you want to make sure you're talking with someone who can appreciate that and say, like, well, that actually might be, it could be bad, but more than likely you're actually you're putting in an antimicrobial and you're getting something that's dying off that shouldn't be there. So I always, a symptom is a really good way to understand something.
Cool.
Yeah.
So, Dr. Andrea, could you give your contact information in case someone would like to? I know you didn't come on here for that, but I know people may want to get in touch with you and make an appointment. So
sure. And let me just say that actually our center is designed for people in a full spectrum of need. So we have a health coach who offers a 3-part program, virtually, for $150. We do a lab result test where we look at 6 pages for labs. It's $150. We really look at ways that are incredibly affordable, so that people can come in and get a sense of what they need, and also to serve the spectrum of care. I mean, it's available. So I have visits. There's 6 naturopathic physicians. We have offices in Lansing, Grand Rapids, Traverse City, and Frankfurt. So we have 4 locations, which is huge. And so I often encourage people too, if they just are looking for health optimization. I mean, I'm a different kind of osteopath in that I believe in the inherent ability to heal, but it's really nice too to work with a licensed, they're not licensed in the state of Michigan because there's no licensure for naturopathic physicians, but these are all physicians who were trained in a 4-year medical school. And so their approach is about health. So I just want to encourage you to see that we have really a huge emphasis on health, and also we have a lot of availability for different opportunities for what people want. So sometimes you just want to have someone hold your hand while you walk through life, and that's great. And other times people are struggling with cancer care, and we offer cancer care support. So, we have this whole range. But anyway, you can find our website at MI Holistic Med. So MI, like it's the Michigan Center for Holistic Medicine. So MI Holistic, HOLISTIC, med, med.com. You can look, you can usually find by Dr. McSwain. So I'm based in Lansing and GR. So DRMC, I have it up there, SWAN. Yeah, we're in Michigan Avenue in Lansing, like Clemens, near Sparrow. Grand Rapids, we're near downtown. So yeah, we have a sauna. We have, just a lot of ways to feel better. And we have a great holistic medical spa. So if you believe in the power of aromatherapy and transdermal absorption, so you can actually get your nutrients through your skin, which sometimes when people are struggling in their gut, they can get a lot of nutrients through their skin. So we have wonderful medical estheticians who offer the skincare treatments that are 99.6% organic and incredibly high grade. I mean, the highest quality of products that you would be used to if you're using Young Living. So anyway, here to serve. That's our goal. Want everybody to live healthy at 100. That's our goal too. So
Yeah.
thank you so
awesome.
much.
Thank you. Any last questions? We'll let her get back to her evening.
Do you have a phone number?
All right, most people are in Lansing, I would say 517-377-2455. And if you are in, so in the month, what is it, January? So in the month of January, usually when I give a presentation, if you want to come in for a free half-an-hour sauna session, then you can call the office and tell them that you were part of my presentation. They should know that, but I'll make sure they know that. I'll write it in our chat. So if any one of you would like to come in for the month of January for a free sauna session, then you can just call the office and schedule that. So you can just kind of see more about our office and who we are. We'd love to have you. We have usually clinics open Tuesday, Wednesday, Thursday. So any of those times, give a call.
Do you know when you're doing your next Boston Heart?
Yeah. So
testing?
so it's a really comprehensive lab review. So if you ever wonder, like, we can test for that. If you have a problem, we can test for that. So it's really about cardiovascular markers and inflammatory markers. So it's 6 pages. It's very impressive. It's $150. And if you want the Alzheimer's gene added, then you pay the lab company $50. And we talk about it. And it's a 2-hour, really comprehensive lab review to understand that. And we're doing it right now. So your labs have to be drawn, fasting labs have to be drawn in our office by the 21st or 22nd of January. And the class is the 11th of February from 6 to 8. And again, if you have any kind of insurance at all, this Boston Heart Lab company will take that insurance, including Medicare. And so the entire program, including the lab draw, is $150. I do often encourage people to do the $50 gene testing for Alzheimer's, because I think if you can prepare to work on brain health decades and prevent that as a problem. You really can address Alzheimer's as a metabolic disorder. If it's very, very helpful. It's so helpful. We don't need people to have problems later in life when there's things we can do 30 years before that, so they don't have that problem, right? That's medicine. That's what medicine is supposed to be. Anyway, I just encourage anyone to, thank you, Cricket. We have all of these, so many things. We have a group liver cleanse coming up in February for March, I think, where we spend a week together. We do some fasting. We do some cleaning out the liver. It's a really good community support. It's an elimination diet that's based on an elimination diet. So it's just really good foundational understanding of nutrition. And it's a great way to clean out the liver, which should be done like spring cleaning, fall cleaning twice a year is kind of my motto for that. So that's coming up. And just really tell us who you are. We actually offer, if you call, a 15-minute free discovery call with one of our health coaches, and she can say, like, what do you need? We can offer you these things. So we really want you to tell us what you need, and we can help you find that in our programs and services.
Okay. Thanks for joining, everyone. I will put this up on YouTube and then send out the email with the link to it so that you can let other people watch it and join in. So, okay.
Thank you. Thank you very much. Very, very informative. Thank you very much. Really loved it. Thank you.
Yeah, it was great.
Yes, thank you. Cricket, where on YouTube, what is this going to be listed under?
Well, it'll be on my page, which is Cricket Lot.
Okay. If
you get any of the emails from that made the announcement for this class, you will you'll get an email with the link to it too. So,
all right.